Hi my friends, welcome back to my channel. My name is Josmal. I help people lose weight with Nigerian meal plans and exercises that are very simple that you can do anywhere in your room, at the gym, any corner you find. Today we are going to be discussing PCOS, Polycystic Ovarian Syndrome. And if you'd like to know more, keep watching. Before we go further, I'd like for you to just click that subscribe button. Subscribe and support your girl. Subscribe to my channel and give this video a thumbs up. Thank you and keep watching. PCOS, Polycystic Ovarian Syndrome, is a hormonal disorder that causes enlarged ovaries with small cysts on the outer edges. The exact cause of Polycystic Ovarian Syndrome is unknown, but there are factors that may play a role in aiding this particular syndrome. Excess insulin. You may ask, what is insulin? Insulin is a hormone produced in the pancreas that allows the cells in the body to use sugar. Low-grade inflammation is a term that is used to describe the production of substances by the white blood cells in the human body to fight inflammation when there is a disease, an infection, or an injury. Hereditary. It could be passed on from a parent to a child. Excess androgens and excessive production of the male hormones in a female. Complications of Polycystic Ovarian Syndrome include infertility, gestational diabetes, or pregnancy-related high blood pressure, severe liver inflammation. Metabolic syndrome, which is a cluster of conditions that may include high blood pressure, high blood sugar, and abnormal cholesterol levels. Type 2 diabetes, depression, anxiety, sleep apnea, eating disorders, abnormal uterine bleeding, endometrial cancer, and all these are under the complications of Polycystic Ovarian Syndrome. The symptoms are more severe in obesity. A lot of women with PCOS always wonder if they can lose weight with PCOS, because losing weight with PCOS is always a struggle. You find that someone without PCOS is losing weight very easily, and someone with PCOS is losing weight with a struggle. Yes, you can lose weight with PCOS if you do the right things. Now, here are some tips to lose weight with PCOS. Reduce carb intake. This does not mean that you shouldn't consume carbs. There are foods with low carbs that you can actually eat and also get the required carbs that can supply enough energy in the body. Eating a low carb diet may reduce insulin levels in women with PCOS and as such may aid weight loss. So you see, when you reduce the amount of carbs that you consume, then this may lead to weight loss and reduction of insulin levels in your body if you've got PCOS. It is also good to take high fiber meals. High fiber meals can make one stay full after a meal. A diet high in fiber may reduce insulin sensitivity and excess body fat, thereby aiding weight loss. So you see, increase your fiber intake. I always stress that one should include protein in their meals, and for women with PCOS, taking meals that are high in protein may go a long way in reducing blood sugar levels and also aiding weight loss, because a high protein meal can go a long way in making one stay full, thereby making you consume less and aiding weight loss. Eat healthy fats, lots and lots of healthy fats. Eating healthy fats can help keep you full, and this may be beneficial to women with PCOS. For example, if someone has PCOS and that person eats healthy fats, this keeps the person satisfied for a longer period of time and as such goes a long way in helping with weight loss. Eat fermented foods. Healthy gut bacteria may play a role in metabolism and weight maintenance. Women with PCOS may have a lower number of gut bacteria, and eating foods rich in probiotics may support gut bacteria. I love fufu. Fufu is a fermented food, and as such, I go out of my way to ensure that I have fufu once in a week or once in 2 weeks. Mindful eating helps promote awareness of internal eating cues and may aid weight loss. And this is always very good for those that may have come up with eating disorders as a symptom or as a complication of Polycystic Ovarian Syndrome. Limit processed foods. Oh my God, I cannot stress this enough. So many people are always eating processed foods, even with PCOS. People with PCOS should limit the intake of processed foods. Even people without PCOS, eat in moderation. I always preach this. Reduce your intake, consumption of processed foods and refined carbs. Certain people living with PCOS love to eat processed foods and refined carbs, and this increases the blood sugar level. Reduce inflammation. Inflammation is common in women with PCOS and has been linked to obesity. Eating a diet high in whole foods like vegetables, fruits, may reduce inflammation. Inflammation is your body's natural way of responding to injury or an infection. Try not to undereat. So many people want to lose weight. Aside having PCOS, people that want to lose weight always go as far as undereating. Try your best to eat well and eat right. Good food, whole foods, not processed refined carbs. So people with PCOS should try not to undereat. When you try to undereat, it goes a long way to shut down your metabolism and as such promote weight gain. Instead of forcing yourself to undereat or eat less food, adopt a diet that would help you lose weight. Diets such as whole foods, unprocessed foods. This would help with weight loss. Exercise regularly. Both cardio and resistance training may help women with PCOS to lose weight and improve insulin sensitivity. Get enough sleep. Get enough sleep. Get enough sleep. Poor sleep has been linked to obesity. Increasing your sleep time, quality of sleep, duration of sleep can aid weight loss. It reduces stress. Increasing your total sleep time, quality of sleep, duration of sleep can reduce body fat and promote weight loss. Manage stress. High levels of cortisol due to chronic stress are linked to insulin resistance and belly fat. Relieving stress through yoga, meditation, your time outdoor, hang out with friends may help reduce cortisol levels in your body. Consider supplements that may help women with PCOS as prescribed by a doctor. This means that lifestyle changes should be taken into consideration. Now, this has answered your question, but this is not a general rule for every woman living with PCOS. There are different types of PCOS. Now, knowing your type of PCOS is very, very important, especially when it comes to diet. PCOS is diagnosed in the hospital by a doctor. So if you would like to know if you have PCOS and what diet changes to make, consult with your doctor, especially in trying to know what type of PCOS you have. So seeing a doctor when you suspect that you have PCOS will determine what changes the doctor would want to make in your everyday living and your diet. Bottom line, losing weight with PCOS can be a struggle, especially for women that don't even know how to go about it. But adopting a lifestyle change that could promote a balanced diet with reduced inflammatory foods can go a long way in helping women lose weight with PCOS. Thank you for watching. Please don't forget to subscribe to my channel.